I'm Brittany Lewis with Forbes Breaking News. Maryland Governor Larry Hogan signed a whopping 140 bills into law on Monday. The bills included the capital budget, COVID-19 measures regarding EMTs, and capping insulin costs. Hogan thanked lawmakers from both sides of the aisle, saying, quote, "We have achieved real bipartisan, common sense solutions." Here's more from the Republican governor's remarks.
Good afternoon. Today we will be signing another 140 bills into law, including a historic capital budget, which makes record investments in school construction projects all across the state, and in an expanded affordable housing program, record investments into Maryland State Parks, and in Chesapeake Bay restoration. We are enacting legislation to cap the cost of insulin amid historic inflation, something that Congress has failed to get done. We're also signing legislation which codifies one of our emergency COVID-19 measures to permanently allow EMTs and paramedics to administer vaccines, as well as legislation that expands the state's commitment to fight Alzheimer's disease. Once again, I want to thank our legislators in both houses and on both sides of the aisle for working together with us during this legislative session and over the past 8 years. Together, we have put the people's priorities first, and we have achieved real bipartisan, common sense solutions to change Maryland for the better. With that, I'll ask the Senate President and the Speaker of the House to say a few words.
Thank you, Mr. Governor. Madam Speaker, it is a pleasure to be back here again this week. You know, it's funny in bill signings that it's very easy to have the scope, the 145 bills, but each individual one has meaning and purpose. There is one today that has a whole lot of purpose, and that's what the governor mentioned, which is the capital budget for 2022. And this is a very big deal. It is the single biggest job-creating piece of legislation that we will jointly sign. And it was a true honor and pleasure to work with the Speaker, with the Governor and his administration to enact a job creation capital budget that was mutually agreed upon and is an incredible, incredible investment in the people of Maryland and our infrastructure. From Southern Maryland to Western Maryland to the core of the suburbs to Eastern Shore, every single part of the state will be touched by this capital budget, and we should be very, very proud of the work that we were able to do together to tell Marylanders that we get the job done. A few other just small points of important bills, and I wish we could talk about them for a while, but child care sector has just been decimated through the pandemic, and this we will be signing a bill into law that provides scholarships and prioritizes lower-income families so that they can get their kids into high-quality care. So critically important as we emerge from the pandemic. Additionally, we will be signing some of the 911 legislation, core infrastructure, creating people safe. A lot of folks don't know how much detail goes into it, and through the work of a number of our senators and House members, this is important work to ensure that Maryland's 911 system is the best in the country. Finally, would like to just call out Senate Bill 636, which is the End the Wait bill, which will impact tens of thousands of children and families, something that our chair of the Capital Budget Subcommittee, Senator Zucker, has been fighting for many, many years, and with partnership with the administration and the House, we were able to get it done this year, and families will be better off because of it. So I'm very excited for today, and hand it over to you, Madam Speaker.
Okay. Good afternoon, everyone. Before I join the governor and the Senate President in signing several more bills, I want to take a moment to recognize the work of the General Assembly. The hundreds of bills that we signed over the last several weeks is a clear indicator of the extraordinary amount of work that the legislature has put in for Marylanders in every part of the state. Maryland has one of the most effective legislatures in the country. In just 90 days, we passed a capital budget and makes critical investments that will keep Maryland competitive, maintain its strong, skilled workforce, and drive a leading economy. Through the budget and with legislation, we put a greater focus on public safety and crime prevention. If we're going to talk about crime, the state needs to be a better partner in preventing crime. House Bill 1018 is the center of that effort. by working with local governments to track and publish more data, improve transparency, and create a safety scorecard will give localities more tools and information in the toolbox and make the state a better partner in the work to prevent violent crime. And health continues to be a top priority for Marylanders and for the legislature. Some of the bills that we're signing today demonstrates why Maryland leads the nation in healthcare and biotech. We're making healthcare more accessible and improving health outcomes in communities most in need. We're strengthening our Alzheimer's and dementia services, doing more to lower the cost of insulin, and expanding the number of healthcare providers in the state. The work that the legislature does is valuable and will benefit each of our more than 6 million residents. I want to again thank our dedicated members for their hard work on behalf of every Marylander. Now let's sign these bills.